Hello, everybody. Live from Dortmund, Germany to you. And I want to talk about the MAMA CT, so Cynological Diagnostics in a New Dimension. And from my point of view, we started 5 years ago with the MAMA CT from ABCT here from Germany, and it made a big impact into our daily workflow. So be prepared to get some nice news about these techniques in the next 30 minutes. So, what it's all about. We are all doing the examination methods we are using to use, so analysis, inspection, palpation of the breast and the axillary line, then mammography, contrast enhanced mammography or tomosynthesis as a part of a technical examination of the breast. And also we do a lot of ultrasound, doppler sono and elastography in routine, but also MRI is a big part. We have 4 MRI machines running only in my institute, producing at least 10 mammo MRIs every day. But still, the mammography worldwide has a big impact, especially in screening. You see the first mammo, by the way, was taken in 1972 in Leipzig by a surgeon called Otto Kleinschmidt. And now it's the most used technical examination technique for the breast. It's fast, it's cheap, it's highly evaluated, and mostly used under screening purpose. And I found out that in 2024, at least 250 million mammals had been taken worldwide, with a steadily growing number so far, starting here from 2005 up till now, and the number is still rising. But what's a problem about mammography? I think you noticed that the main reason why the mammography is rejected for a normal woman is pain. At least up to 91% of all women think that mammography is disturbing and painful, and at least up to 15% say it's a intense pain and completely reject this examination method. This depends on different parts, so the hormonal status, premenstrual or premenopausal, so the tissue density, mastopathy, or other problems, and also hormone replacement therapy can make problems. On the other hand, there are technical issues like the technician. Is she very empathic, or is she just doing her job? Circumstances, atmosphere. Do you have a patient who is very tense and stiff, or is it a stressy atmosphere? And also the mammography device itself plays a big role with the compression control, and the modern system is more sensitive to most breasts. And looking at all the modalities which are using every day, this is a nice overview. So we look at mammography and the tomosynthesis, the sonography, ultrasound, and MRI. And there are surely some advantages and disadvantages you know very well. So mammography is a 2D technique, tomosynthesis with a kind of 3D imaging. Sonography is also 3D imaging in modern times, and MRI for sure. Superimpositions. Every day we done a mammography to denser breasts. We are dealing with superimpositions. To get rid of, you have to use tomosynthesis, sonography, or MRI. And so you can walk through these points and at least come to calcifications, microcalcs, which are at least not visible in MRI. You are used to use MRI with contrast enhancement because you can't see the microcalcs. And the comfort, yeah, for clear mammography and tomosynthesis are quite uncomfortable. Sonography is okay, but there are a lot of patients who refuse to even go into an MRI bore and to be laid down there for at least 30 minutes. So every modality has its problems. What is really missing till now and till the Mama CT is a 3D examination with a high patient comfort, also superimposition-free representation of the breast with the visibility of microcalcifications, and also including the possibility of using a contrast agent. It was not there on the market. And now, since 5 years or even longer, there have to be two machines called Mama CT available on the market. I want to go deeper in detail. The left one is the one we are using from ABCT here from Erlangen, Germany, called NewView, and the other one is the machine VeraScan from Koning, US vendor. And from the technical aspect, they are a little bit different, but doing quite the same. If you compare these Mama CTs to a normal CT, you see doing a normal CT, you will end up with a longitudinal examination, an actual direction of examination of the whole body. We have a short examination time from head to toe in 5 seconds. The whole body is irradiated because the tube is going around the body, and you have at least a large distance between the tube and detector with the highest resolution of approximately 0.5 millimeter. And this is routine every day, but this is quite useless for the mammo. The Mama CT in order has a complete other setup, complete different setup. You have an examination in the frontal plane at the longitudinal axis of the breast. The patient is in prone position, the breast free, hanging in an opening, and the technique is under the table. You have no radiation of the rest of the body, and you have a small distance between the tube and detector, and therefore an extremely high resolution down to 0.15 millimeter for the ABCT in an isotropic voxel. That's immaculate. And looking at all the points, you have a highest patient comfort with no compression of the breast. You have no narrowing tube to fit in or to lay in for at least a few minutes. You have a short examination time of about 5 minutes for 2 breaths complete with contrast media and everything. You have a high image quality. It's a 3-dimensional manner without any superimpositions and the contrast media possible examination, which lift this examination up to a functional examination. And also, and that is for sure a serious theme for the breast, you have a very low radiation exposure. It's the same as in FFDM. So looking at all the points we are talking about in senological diagnostics, the Mama CT looks quite well because you are combining 3D imaging with a superimposition-free manner. You can use contrast media. You have the visibility of microcalcs in a 3D manner, and you have a high comfort for your patients. And looking at the details, so the technical structure, firstly, of the ABCT scanner. This is a dedicated spiral breast CT system. When you open the bore or the compartment, you have an access door to the scanner. You have an opening for the breast and the patient table. And when you open this door, you get this image. You see on the left side the detector, a breast cover, on the right side the X-ray tube, and the positioning mirror on the bottom. And in action, it looks this way. You see when I start the video, there's a rotating, and the breast is here. It's a model breast, a phantom, and you see the starting with the rotation, and then it goes in a spiral manner to the nipple down. The whole gantry is sliding down and doing the scan in at least 12 seconds. Now the complete scan is done and the images are reconstructed. This results in a very short examination time. You have almost no scattered radiation because the table is also shielded. You have reduced artifacts. There's no motion in the breast, and you have a very high comfort for your patients. On the other side, the Koning Vera breast CT system is a conal CT system with a source and a detector. And in the video you see here, the patient is also positioned the same way in a prone position. And then there's one round the device takes, also about 6 or 7 seconds, quite short. And then the images are done. The advantage of this system is that you can do biopsies. They have a device which is mounted into the machine where you can do stereotactic or even 3D biopsies of the breast to take a closer look at microcalcs or other tumors. So quite interesting, well working. And the comparison of the two machines leads out that they have some very equal things. The big difference is that the ABCT has a CE clearance, but the Koning Vera scan has also the FDA clearance, and that is maybe a big advantage for this vendor. And the other advantage for Koning is that they have this biopsy device integrated in their system. The other points are quite the same. What is going on worldwide? We are talking about Koning more in the US market. You see, these are the latest installations. In Germany and Europe, we have about 6 installations of the ABCT, and I can tell you that the next installation is done now in Brisbane for Koning, the first Australian mammo CT installation so far. And now let's switch to our clinical experiences and some cases I want to demonstrate, because that's all theory. You want to see images. And this is the normal setup you will get using your mammo CT. We are, by the way, using single carbon from Siemens Healthineers, and the 3D imaging which are delivered by the system are visualized in the system. You see the right breast, the left breast. You see multiplanar reconstructions, very thin, 0.3 millimeter thickness. You see this is the thickness of the images, and you can in this way move through the images in a coronal way. Remember, left, right breast. And this is a demonstration of an operated breast after breast conservative surgery and treatment. You see the liponecrotic calcifications in the left breast. You see the markers. Remember, especially patients who underwent the operation have serious pain during compression of her breast in a mammography. This is complete pain-free and done in 5 minutes complete. In this case with contrast media. You see the contrast medium in the vessels of the breast. And what you get exclusively is a VRT of the breast, a 3D VRT where I can move and zoom around and pan and get all the things visualized you ever dreamed of. This is absolutely astonishing. You see the macrocalcs, you see the clips, and you can tell everything in detail what's going on in this breast. for your patients and also for your reference, the surgeons or anyone who want to see it clearly. So routine, the images are prepared itself. I don't have to do anything to get this image quality in daily routine. Even when you change window and contrast, you can see it from the outside of the breast, looking at the scarring and everything. Another case done in routine because this patient was referred to us after an MRI of the breast, and the colleague said, okay, there's a lesion in the right breast, but it's benign. It seems to be a fibroadenoma, and we did a contrast-enhanced mamma CT, and you see after at least 3 seconds that this is not normal. It's a malignant issue of a tumor in the right breast. It takes a lot of contrast. That's normal for malignancy, and it has a spiculated appearance. Remember the high spatial resolution of the system, and now you can go on and measure the size and distance to the nipple and show these findings to your colleagues. Yeah, this is a accurate and fast diagnosis and a typical appearance. And also you have the multiplanar reconstructions where you can see the spiculated lesion and so on in every direction. So this in a coronal view, also from in an axial way. And in a sagittal way, almost comparable to an OBL view in the normal mammo. And this is a very nice case, case number 3. It's a comparison between an older on the left and a newer scan of the right breast, 2 years difference. Same patient, you see it immediately, it's the same breast. It has a high reproducibility in daily routine. And you can look around in the VRT and then make it more transparent. And even here, after a few seconds, you will recognize there's something going on in the right breast. I hope this will go on now and don't stop. Not sure what it's doing. The video, there you can recognize the small tumor at 2 o'clock. You can measure also here the distance, and you can compare the prior and the actual images. So prior, absolutely normal appearance. Now there's a small tumor in the right breast. I'm not sure what's going on here with my computer. Will it go on? And also you can use this lining to get a closer view to this tumor in a 3D manner. So absolutely comparable, and you detect the tumor, in this case, even without contrast media. If you get familiar with the system, you find out that carcinomas have a higher density, especially in this 3D imaging, than a normal tissue. This is a nice case of a patient who underwent breast conservative surgery and radiation a few years ago, and came again for a scan of the breast, and this is done with contrast. And if we stop at this location here, you can see there's a cutis, there's scarring, and then it goes through the subcutaneous fatty tissue into a scar which is here and which will take no contrast media at all. And then we have a invasive carcinoma where it takes contrast media and we have microcalcs. And further away from this invasive carcinoma, we have a DCIS represented by microcalcs. And I did a biopsy in this case, and what I told you was completely taken by the pathologist. So my needle goes this way through the tumor, through the scarring into the DCIS, and it is completely what the pathologist found in its probes. So the biopsy and everything with elastography comes later. Yeah. Another case number 5. This is a nice case because this patient has a histologic found of a DCIS. You see the marker after stereotactic biopsy, and she's quite special. She refused to do a surgery on her breast and get controlled 3 months after the detection of the DCIS. And what I want to demonstrate you here are the typical intraductal calcifications of the DCIS. This is an entity you will miss on every MRI. And this examination especially is done without contrast media. So if we have done it with contrast media, you might also notice the small enhancement, but this is done without contrast, but the DCIS is nicely visualized in the multiplanar reconstructions with the clip marker in the coronal view. With a resolution of 0.3 millimeter. In every direction, so sagittal view. But it's nevertheless very helpful to get this VRT, which gives you a clear 3D impression how big is this lesion, where are the microcalcs starting, where is the ending, and maybe which way of surgery is mostly efficiently for this patient. So there's a big DCIS, maybe there will only be the possibility of an ablation, but anyway. So you can measure everything and see the distance is here at least 9 centimeters. Big one. What comes out to be a big deal, at least, are the pain-free examinations of implants. Most women who get their implants are not completely sure about what is the right examination in future. And the main thing is that you don't have any compression on this implanted breast. So you will end up with no risk of a rupture concerning the compression of the breast. You have no blind spots. If you look at the plain mammography, you will come out with different parts of the breast which you can't visualize in a normal mammography. You have a high resolution 3D images of the breast tissue, but also of the implants and the surroundings. And you have a unique display of the calcifications in case of a capsular fibrosis or anything. And this is a young woman which showed up with a palpable lesion in her left breast. It was a palpable thing we have to do an ultrasound, which shows almost nothing. Even our colleague who implanted her seemed to want to reoperate her, but after the mama CT, you can clearly see the problem of this implant was an infold. There was simply an infold of the silicon, and because it was nearly under the surface of her breast, it felt ugly and was palpable. But after the mama CT, it was quite clear that there's no serious problem, and she don't have to do anything to her breast, at least an operation. So everything was fine for her, and she was absolutely happy with this examination. This is another case. This is an elderly patient, and this implant is about 25 years old. And she was referred to a mammography. And when I saw this breast, I said, oh, maybe we should be careful about the compression. If you look closer, you see there's a bulb, a bulby appearance of this breast. And it was hard like a stone. And we did a mama CT. And this is what it comes up. It's a kind of VRT we are using. It has more of a 3D manner. And what you see actually is not the implant. It's not the implant. It's a calcificated capsula of the old implant. The implant itself is completely closed and destroyed, and the silicon is kind of resolved. So it's only a calcified egg. And if you have done a compression to this breast, there would be a complication. There would have been a complication, and the patient would maybe have a swelling and heating of her breast and had to be operated. But this is a very special thing which you can only see with the mama CT and with no other modality at all. Remember, this is not the implant, this is only the capsule the body has formed around this ruptured implant. As long as you don't touch it, there's no problem, but don't do a mammography on this thing. And this is also a nice complication which occurred at least in one of 10 implants. And this patient get a normal mammography because she had a funny appearance of her breast. It looked deformed. It looked not like a breast, actually. It looked like a banana. And she was very unhappy with the result. But the form of the breast had changed in the last 3 months. And so we did a mama CT. And what we found out and what is visualized in the sagittal view, but also on the other views like this coronal view, and especially in the 3D manner, is a flipped implant. A flipped implant is a serious problem of smooth implants which tend to rotate in the capsule of the breast, and they completely turn around. And this what happens to this patient. You see the funny appearance of the right breast, very annoying for the patient. But you noticed what happened when you go in a 3D manner, because what you see on the images is the side of the back of the implant. So this is a nice visualization of the normal tissue of the breast and also the implant deep in the breast, not under the musculus pectoralis. But this surface you see here and the dots have to be on the back of the implant. A positioned implant like this, a flipped implant, is a serious and annoying complication for every woman who underwent this procedure. So you see, it's quite helpful. It's a very fast and helpful technique and modality. And what are the limitations of the mama CT? So at least for the ABCT, it's a position for the patient. They are lying in prone position, and if they have massive cervical spine problems, it could be a problem. So also, very big breasts have a problem in the quite small opening, which is about 16 or 18 centimeters, and the weight. There's a weight limit on the ABCT for 130 kilos, because more it gets serious damage on the table. Conclusions. What is it all about? The Mama CT offers you 3D images of the breast without any superimpositions. You have a functional examination when you're going to use contrast media. You have isotropic high-resolution 3D images of the breast and an excellent contrast between glandular tissue and calcifications. You end up with a short examination time. It's the same time you have to notice for a normal mammography. You have a low dosage. It's completely comparable to FFDM, and you have an outstanding patient comfort. And the indications we see very brightly. So especially for screening and for all those patients who have a very painful mammography or even a fear of pain or personal reasons not to underwent a mammography. It also is very helpful for further clarification of conspicuous finding like microcalcs, contrast media in a multiplicity, tumor localization in a planning of a surgery or BET, breast conservative surgery, or monitoring after and through a neoadjuvant chemotherapy. Also, it's very helpful for all the contraindications for MRI patients, like pacemakers, claustrophobia, other implants or devices which you can't take into an MRI bore, or you have a serious contrast media allergy against gadolinium. And also patients with implants, so breast implants, to get a proper imaging of their implanted breasts, or to visualize the problems which I showed you. And also we figured out that you can do a 3D galactography in case of secretion. It's a very perfect method to do a 3D galactography, very interesting, but very small part of the machine. The costs, it's not that expensive. The machine is expensive, but at least the costs in Germany are taken by the self-payers or the private health insurance and are about 450 euros per examination. And we do a normal scheduling via our head office or direct in our department. And so, thank you. By the way, we have now get some very nice feedback over the last years. We had done German Medical Award in 2021 for this work. Also, we have a nice recommendation from Leadership in Breast Imaging and the Radiology Awards for our working. And thank you very much for your attention. And if you have any questions, don't write them. Just write them or have a deeper look at LinkedIn. You can also write here under my k.ridder@mwz-ulmbrock.de. Thank you very much. Bye bye and have a good time.